Imagine the back of your eye as a complex highway system. Blood vessels, specifically veins, carry deoxygenated blood away from the retina, the light, sensitive tissue at the back of your eye. Now, picture a major traffic jam on one of the main highways. That's essentially what happens in central retinal vein occlusion, or CRVO. It's a blockage in the central retinal vein, leading to a backup of blood and fluid within the eye. This can damage the delicate retina and potentially lead to vision loss. So, what causes this retinal traffic jam? The most common culprit is high blood pressure, or hypertension. The increased pressure can damage the walls of the retinal vein, making it more prone to blockage. Other contributing factors include glaucoma, a condition that increases pressure inside the eye, diabetes, which can damage blood vessels throughout the body, and certain blood disorders that make the blood thicker or more likely to clot. In some cases, the cause remains unknown. Let's delve a little deeper into what's actually happening inside the eye. When the central retinal vein is blocked, blood and fluid can leak into the retina. This causes swelling, known as macular edema, which blurs vision. The blockage also reduces blood flow to the retina, depriving it of oxygen. This lack of oxygen, called ischemia, can trigger the release of a substance called vascular endothelial growth factor, or VEGF. VEGF stimulates the growth of new, abnormal blood vessels, a process called neovascularization. These new vessels are fragile and prone to bleeding, potentially leading to further vision problems, including glaucoma and retinal detachment. CRVO is a fairly common condition, affecting approximately 1 to 2% of people over the age of 40. The risk increases with age, and it's slightly more prevalent in men than women. People with conditions like high blood pressure, diabetes, glaucoma, and cardiovascular disease are at a significantly higher risk of developing CRVO. The symptoms of CRVO can vary depending on the severity of the blockage and the extent of damage to the retina. The most common symptom is sudden, painless blurred vision in one eye. Other symptoms may include floaters, which are small dark spots that drift across your field of vision, distorted vision, and in severe cases, significant vision loss. It's important to note that some people with CRVO may not experience any noticeable symptoms initially, highlighting the importance of regular eye exams. Diagnosing CRVO typically involves a comprehensive eye exam. Your ophthalmologist will dilate your pupils to get a clear view of the retina. They may use several diagnostic tools, including visual acuity testing, to measure your sharpness of vision, ophthalmoscopy, to examine the retina and blood vessels, optical coherence tomography or OCT, which provides detailed cross-sectional images of the retina to assess swelling and damage, fluorescein angiography, a procedure where a dye is injected into your arm and images are taken of the retinal blood vessels to identify blockages and leakage, and intraocular pressure measurement, to check for glaucoma. CRVO can be classified into two main types: ischemic and non-ischemic. Ischemic CRVO is characterized by significant retinal ischemia or lack of oxygen and carries a higher risk of complications like neovascular glaucoma. Non-ischemic CRVO, also known as perfused CRVO, has better blood flow to the retina and a lower risk of complications. The type of CRVO is determined based on the extent of retinal ischemia observed during fluorescein angiography. Unfortunately, there is no cure for CRVO, but treatment aims to manage the complications and prevent further vision loss. The primary treatment options include anti-VEGF injections, which help to reduce macular edema and suppress the growth of new, abnormal blood vessels. Laser photocoagulation, which involves using a laser to destroy areas of the retina lacking oxygen, reducing the risk of neovascularization, and corticosteroids, which can reduce swelling and inflammation in the retina. In cases of neovascular glaucoma, surgery may be necessary to lower the intraocular pressure. While not all cases of CRVO are preventable, certain lifestyle modifications and proactive measures can significantly reduce your risk. These include maintaining healthy blood pressure through diet, exercise, and medication if necessary, controlling blood sugar levels if you have diabetes, managing glaucoma with prescribed eye drops or surgery, quitting smoking, which damages blood vessels, and undergoing regular comprehensive eye exams, especially if you have risk factors for CRVO. The prognosis for CRVO varies depending on the severity of the condition and the promptness of treatment. Some people may experience significant improvement in vision with treatment, while others may have persistent vision loss. Ischemic CRVO generally has a poorer prognosis than non-ischemic CRVO. Recent research is focusing on developing new and improved treatments for CRVO, including novel anti-VEGF agents, sustained-release drug delivery systems, and gene therapy. Clinical trials are ongoing to evaluate the effectiveness of these innovative approaches, offering hope for better outcomes for people with CRVO in the future.